Something I'd like to address is a lot of the YouTube comments we get, people see blood in the urine, they have, urinary issues, and a lot of times because they don't know that prostate cancer doesn't have any symptoms, they immediately jump to prostate cancer because they see blood, and obviously that's alarming. So can we talk about for a second the common symptoms that we'd have with prostatitis and how that's not prostate cancer?
Yeah, so what was distinctive in the story that I shared was that this individual had what we call chronic prostatitis, and he didn't have any symptoms, so just a high PSA. But men that feel something, we call that acute prostatitis, and they can have blood in their urine, they can feel feverish, they can have pain in their pelvic region, discomfort with sexual activity, all these things. And oftentimes that's a bacterial infection, and it will respond to antibiotics and improve, and then the PSA levels will drop once the acute prostatitis is passed. So the confusing thing is that a lot of men that have acute prostatitis can also have chronic prostatitis, and they can also have, of course, low-grade prostate cancers, all mixed, and we're trying to use PSA to sort all this out, and PSA just doesn't have the horsepower to make that distinction. It just goes up with any problem. It's not specific for cancer or prostatitis. And the acute prostatitis you're talking about is a known entity that urologists are familiar. PSAs run high for a while, but then they come down afterwards when you give a course of antibiotics.
So we've covered the symptoms. Now, in those treatments, how long do they take, and are they really effective? What's the fear of maybe the prostatitis coming back? Is this a chronic thing that they're going to have to be doing?
You may have to take antibiotics for 3, 4, 6 weeks sometimes to get rid of acute prostatitis. It's a difficult thing to eradicate, and then it does tend to come back again, and it often will turn into a chronic prostatitis situation. We don't have easy, good solutions. I use antibiotics now in my practice a lot less frequently because you may solve a short-term problem and get the PSA down, but then it's right back again after a year or two. So more symptomatic things, saw palmetto, anti-inflammatories like Aleve or Advil, and just patience waiting for it to kind of run its course and calm down on its own. Otherwise, these men can be on and off antibiotics all the time.
So I know you're mainly prostate cancer, but since you're checking PSAs, I would imagine that you're seeing a lot of men with acute prostatitis. So how do you handle those men?
These are people that have symptoms, feel sick, and usually they go on antibiotics, and those antibiotics are effective in most cases. There are some men that have antibiotic-resistant prostatitis, and it can be a very debilitating condition. Dr. Bahn, who perhaps many of our listeners have heard of, a specialist, an interventional radiologist that does color Doppler ultrasound for prostate cancer and prostatitis, has actually developed an injection of antibiotics and cortisone that he puts in the prostate in these men with these really difficult prostatitis illnesses. So that is a backup plan that's not widely available. I'm not aware of anyone else in the United States that's doing that, but some men have really challenging acute prostatitis situations, and it's nice to know that there's someone out there that has a backup plan if the standard antibiotics aren't working.
So the antibiotics you're talking about, is that like Cipro or Levaquin, anything in that category?
Yeah, the Septra, there are a whole list of antibiotics, but when you hear of antibiotics for prostatitis, Cipro and Levaquin are the most popular.
What type of side effects would those antibiotics have? Do they have any, and anything that patients with maybe prostate cancer need to be aware of?
Well, Cipro and Levaquin are of a concern because they can cause weakening of the Achilles tendon. I've used a substantial amount of these antibiotics and haven't really seen that problem, but when you look in the warnings, that is possible for people even to develop a rupture of their Achilles tendon, which is a very serious injury. So we're always hesitant to use these antibiotics unnecessarily, and then when they're used for longer and longer periods, it's probable that the risk of tendon problems would go up. So apart from that, all antibiotics can mess up the flora of your intestines and cause diarrhea, but otherwise they're pretty well tolerated.
Is there anything that a patient can do to mitigate the side effect with the Achilles tendon?
No, it's just a matter of luck of the draw, and physicians need to be careful not to overuse these medicines unless they're really, really necessary.
And with the injection from Dr. Bahn, what success have you seen with those patients getting that injection?
Oh, excellent. He's developed national reputation for the treatment of prostatitis, and thankfully that type of resistant prostatitis is fairly rare, but some men are completely incapacitated by constant pain from the infection in their prostate. And I'd say that he has been very successful in helping 3 out of 4 patients to go to see him who get these injections, and they get notable relief.
And do they have any side effects?
No, it's a very safe injection.
Thanks for watching. If you would like more information about anything we spoke about today, you can visit our website at pcri.org for more information. Also, subscribe to our YouTube channel. We have all sorts of prostate cancer videos coming out every single week.